divided into two planes, and each is referred to as a lamella. So this section that you're looking at is the posterior lamella, and this section is the anterior lamella. And in the posterior lamella is that side which is facing the orbital part of the eye. So in other words, the cornea is going to be on this side, and the other side is going to be external. So this is the external side, and you can know it is external because of the presence of what? Of the what? Hairs. And if you look at the epithelium is also a kind of epithelium which you'll find on the outside, which is stratified squamous epithelium. Alright, so you can see a nice stratified squamous with this layer, which is the what? What's that layer called? Come on, man. What's that layer called? Stratum basale or stratum germinativum. And its germinativum or germinative layer is the better term, because it is the layer that produces all of the other layers that are above it. And what are those layers? Above the germinativum, what do we have? Immediately above germinativum, what do we have? Spinosum. Right, so above the germinativum, you're going to have the spinosum layer, and then you're going to have another layer where the proteins within the cell is becoming more pycnotic. They are coming denser, coming closer together, so you have the stratum granulosum. And then above that, you will have them becoming the lucid layer, stratum lucidum, and then on the superior surface, you will have the corneum, or sometimes that layer becomes keratinized. Keratin is formed, so you can have the keratinized kind of epithelium, which is protective and which is on the outermost layer. So basically, you have your germinativum, and then you're going to have your spinosum layer, and then your granulosum, and then the lucidum, and then the last of all, the corneum. So those are the layers of the skin. Now deep to the skin, then you are going to have what? What do you have under the skin? What is under this? Underneath the epidermis, what we have? We have dermis, and the dermis is formed from what? What germ layer produces the dermis? We're pulling teeth this morning, man. What's the layer that produces all of this in which you have blood vessels? Mesoderm. Mesoderm. Good. And in that layer, you're going to have the elements that give rise to skin. Within the skin, you're going to find that there are hair, so sebaceous associated glands are going to be present, and you're going to find hair shafts and hair follicles within this. You will also find that there will be elements related to nerves. The lid is very sensitive, so in the lid you're going to find pressure sensors, such as what? Tell me one pressure sensor in the skin. Meissner, yes, Meissner. And when you know what the Paxinian looks like, wherever you see it, you can recognize it. But what are these reddish things inside here? What are these reddish things we find inside the skin? What helps to make your hair stand on end? Huh? What makes the hair stand up? The arrectores pylorum. Right, so within dermis you'll find that there are elements of smooth muscle within the skin. Alright, and then you'll find nerve connections. So the lid is rich with a lot of elements. So you're going to find our connective tissue, regular connective tissue elements, blood vessels. What are these sharp red areas that we are seeing here? What are these? Under the pointer. Skeletal muscle. What skeletal muscle is present within the lid? Skeletal muscle in the lid is what? Some of it is going to be from what? Sorry? Skeletal muscle in the lid would be represented by what are the muscles that have to raise the lid? Or LPS as well as fibers of what? Orbicularis. Remember we are on the outside, right? So within the lid you could find some of these fibers. Now underneath, deep to the lid, you'd also find some more smooth muscle. And muscles, let me get down on the low power. Right, so you see the skeletal muscle. And also you'll find other smooth muscle within. And smooth muscle within, some of it is going to belong to whom? Mullus. So, and these fibers would be coming underneath LPS. This smooth muscle fibers underneath LPS are referred to as Mullus muscle. And when will they be affected? What condition? What is the condition given when named when these smooth muscles are affected, are paralyzed? We get Horner syndrome, and how would the eye look? The eye would fall. What's the normal size of the fissure? That's the space between the lower lid and the upper lid. What's the normal width? What's the normal width? 12 millimeters. 12 millimeters. As one gets older, then one can lose elasticity in the ligaments that help to keep the eye up. The lid can actually start falling. And so with aging, the lid falls and the palpebral fissure becomes smaller. And a fall of 2 millimeters is acceptable. Now, deepest within the lid is the tarsal plate. And this dark, dense area that you're seeing inside here is the tarsal plate. And this tarsal plate helps in giving the eye its contour, giving the lid its contour, as well as its shape. If there were no tarsal plate with the muscles present within, the eye's lids would be pretty shrunken pieces of ineffective coverings. but because of the presence of the tarsal plate, it helps in giving stiffness, form, shape, curvature, contour to the lid. And so the lid is functional. Now, is the lids, how do they develop? How do they develop? Is the lid always present? Just yesterday we were talking about the development of the mesoderm of the kidney. And the lid itself has a time of development, and it also needs a time for closure because it is covering the cornea, and the cornea can become epithelialized, and the cornea needs to be protected. And so around the 3rd or 4th month of life, the eyelids come together. The lids come together, desmosomes hold them in place. And after these eyelids are held in place, the meibomian glands develop. So the meibomian glands develop at the time when the two lids have met together. And it is during that time the meibomian glands develop and the fatty acids are produced. And it is these lipids that cause the eye to open around the 6th month of intrauterine life. So between the 4th and 6th months of intrauterine life, the two lids are held by desmosomes. And it is during that time the meibomian glands are formed, and then they are formed within the tarsal plate. If you look at these glands here, look at them. Well, this is glandular. All of this stuff, pretty stuff that you see in here. These nice, pretty glands here. All down. Look at them, like a tree. Coming right down. And they are all within the tarsal plate. They are not outside of it. They are within this tarsal plate. Please remember that. The meibomian glands are within the tarsal plate, and they develop during the 4th to 6th months of intrauterine life. Produce sebaceous material, and this is believed to be the substance that helps in causing the lids to become separated around the 6th month of life. Yeah. The eye needs to be protected, and so these the meibomian glands, they are going to produce lipids, and the lipids help in producing a coating for the eye so that the eye can be formed. You can have clarity, transparency, light can move through with beauty, because there is no water to be picked up. Because if you put water on a tissue, bare tissue, what will happen to the water? It will become absorbed, because the proteinaceous material within the cells is going to exert an osmotic pressure and pull water into the cells so that they become hydropic, and they become cloudy, and they will not be dry, in the sense of there'll be water, they'll be soggy with water. But having the sebaceous fluid, the glands producing these fatty substances, glycerol esters, lipids that coat the eye, then water cannot get to it during the amniotic fluid cannot get to the eye. You follow? So it's just beautiful, well protected. Yeah. So here we have the sebaceous glands. meibomian glands, and they produce a sebaceous-like material. Internal to these meibomian glands, look at it well. There are some other glands here. And what are these? You notice they look different. They're at a higher level. The meibomian glands go right down towards the tip of the eyelid. But these glands are higher up. They are more towards the fornix. And these are the glands of Wolfram. And these produce a serous secretion. Let's look at them on the higher. Side. Guys, bounce this thing out of the way. Let's go back. Alright, so these are the which ones? What are these? Shout it out, man. How about? What's the name? Meibomian. How you spell that? M-E-I-B-O-M-I-A-N. Good. So these fellows that are higher up, these are the serous glands. Okay, let's come up a little higher. Right, and there you see them. These are the glands of Wolfram. Good. And then as you come towards the epithelium here, the epithelium has two kinds of cells. Good. So the inner ones are parallel to the surface, and the upper layer are at right angles. They are vertical. You get that? So those on the more superficial ones, the nuclei are more vertical. In other words, they are in line, kind of straight, whereas the basal ones are running horizontally. Right. Now, sometimes within this layer, at a higher level, you might also find goblet cells. And it is the only place in the body where you can find goblet cells among what is supposed to be a stratified squamous kind of epithelium. All right. So the eyelid, very interesting place. Let's look at the tip of it. At the tip, Oh, I was on the top section, close towards the fornix. Right, so I left there and I am coming right down towards the tip, towards the edge of the eyelid. Within the eyelid I have the tarsal plate here, which is in the posterior lamella, and I'm coming right down to the tip. Yeah, and even right in the tip, you notice what I'm seeing here? What are these cells here? Right on the edge. Can I make it out? What are these? Sorry? Shout it louder, man. Skeletal muscle. So it means that even right in the tip we have orbicularis fibers that help us to close the eye tight. So when you shut it tight, you know, somebody has a little problem trying to push it up, to open it, okay? And you need that kind of skeletal muscle even right at the tip so that you can close your eyes properly. When you are riding on a motorbike and you move into a lot of dust particles, you get me? The eye protection is one of your key things. Are you with me? Protection. You have to protect your eyes. I mean, they are so important. Without them, you have to be led around the place. Two little balls, but you have to hold on to them. You can't get them messed up. Protected. They have to be. All right. Right on the edge, we have some. Let me get down to a lower power. And what is that underneath the pin? On the edge of the thing. What is being pointed at there? On the pointer. I guess you have 2 pointers. Or what is this dark one? Hair lash. Right, the hair lashes. And associated with the hair lashes, then you have 2 kinds of glands. The glands of Moll and the glands of Sees. And they as well are sebaceous in type. So the oil glands are very important. The water, like the serous, glands of Wolfram, glands of Krause, they are higher. Krause is right up in the corner, in the fornix, and Wolfram is on the lid, but higher than the meibomian glands. Okay? Any questions? The eyelash, Zis and meibum. What is this thing here? What's that? Looks as if this would be a good thing to put on the exam. What exactly is it? What is the pointer on? The pointer is on a hair shaft. It's on a hair shaft. And the center of a hair is called the medulla, and it usually is like a hollow and tends not to be deeply pigmented. If you look at this material here, if you look in the center part of it, it appears to be hollow, and the center itself is not deeply pigmented. So when you think of here, the color is really kind of peripheral, the pigmentation. Yeah. What are these? What are those? Remember, I don't know what is in your mind, you know. And I don't want to know that it's exam time and it's rubbish that comes out of your mind. Because it will not be to your credit. So it's better that you let me know what is in the mind so that it can be corrected, rather than keep your mouth shut because you're afraid that somebody might say you're stupid. What is it? Huh? Sorry? I didn't hear that. Go ahead. Oh, this. Okay. Well, you're on the track. But I kind of wanted it in terms of even without the man's name. Just looking at stuff like that. What is it? Ah, very good that you said that. Very good that you said that, because there is no mucus gland down there. None at all. Sebaceous. That's the word. Sebaceous. And remember, you know, there is a whole heap of serious science intelligence built into the eyelid, you know. So you can't have mucus inside there because it's going to cause trouble. Mucus is sticky. You can imagine things sticking up in your eye. You run for a little place, you run for a little dust bowl, whole heap of things stick up in your eye. So it's not going to, God not going to make it like that because that's not smart. Sebaceous glands are going to be there. Okay? And even the sebaceous glands of Mull, they are not coiled up, they are uncoiled. So the stuff can come out easily. Yes. Matter in the eye, usually that will happen if there is an inflammation. If there is, for example, if you, let us say a virus is going around and it happens that you picked up the virus, or maybe you're rubbing your hand on your eye and your hand wasn't clean, and you transmit an organism to the lid, and it can become infected, and the white cells from the mesoderm will multiply and produce, you'll get a conjunctivitis, and that will produce the so-called matter in the eye. But the normal eye wouldn't have any significant matter produced. If you sleep and wake, it is likely that, and you don't have any redness or anything pointing to an infection, it can just be organisms, because you see, you can have infection which is low grade and it doesn't. But normally, you would sleep and there wouldn't be really any problem with the eye. Yes. But if you find that there is, it can mean that you have a little low-grade infection. And that produces secretions. It increases the amount of glandular activity in the eye. Yeah. All right? Any more questions? All right, so we can move on to something else. Let's look on the cornea. Look at the cornea. One thing I should tell you is that preparing the eye for histology is not an easy job. Because I don't know if you remember seeing the eye when I cut it across. You remember I had a knife, a long knife, and I was cutting it, was pretty tough on the outside. And then after I cut it, I got into the vitreous, which was watery. And then imagine that in this watery setting, there is this tough thing on the front. What was it? I took out a tough ball. You weren't there? Ah, that's why. That's why. Remember the things that you see. It's the physical things that you see, they remain with you longer than pictures. Don't underestimate these things. That's the reason why medicine involves going to hospital. That's the reason why being a shipman, you must go to sea. You can't go and look in book and look at nice pictures. Otherwise you can't deal with a storm when it comes. And the exam can be a storm. So don't go in there with just picture knowledge. Yes, I had difficulty cutting it through, and then when I opened it up, it showed the retina. The retina was very coiled up on the inside, and it was stuck more towards the back of the ora serrata. And it's very difficult to prepare in terms of preparing a histology slide. Because look, your lens is a tough thing, and it is in a watery setting. So how do you cut that without shifting the lens? You get it? Is not an easy thing. So when you look at some of these pictures that we have here, the real stuff, recognize that there are real difficulties in preparing